So with that, I just want to say welcome and thank you for joining us on our virtual platform. My name is Shantice Mantia. I'm with Baptist Health South Florida, and we are a healthcare organization committed to really bringing health and wellness to our community while we're staying safe at home. For those of you that are new and joining us, I will be providing some information via chat. So this is webinar style, where we cannot hear or see you, but you will be able to hear our amazing speaker, Dr. Grant, who's with us today. With that, I'll pass it over to him. How are you this morning, Dr. Grant?
I'm very good, thank you. How are you?
I'm great, thank you. I'm very excited to learn a little bit about sleep during this COVID time.
Well, we're going to be talking about sleep medicine and some very interesting cases. So I think hopefully it'll be educational and interesting as well.
Wonderful, thank you. So with that, please go ahead and get started.
So my name is Timothy Grant. I'm a neurologist, but I'm a sleep specialist. So all I really do is see things that have to do with either disturbed sleep at night or being sleepy during the daytime. I'm the medical director of a sleep laboratory of Baptist Hospital, and I also have a private practice in sleep medicine. So today we're going to be talking about sleep and what I see generally as a sleep specialist, but I also thought I would weave in some comments about how sleep and sleep medicine is being affected by the coronavirus pandemic right now. So as you can see, I've called my lecture Pandemonium and Pandemics, but let's go through and talk about some things that I do on a regular basis. So here's a slide of one of, this is not my actual patient, but it's a patient who actually did this in his sleep. And I'll be talking to you about it later. It's kind of entertaining and very disturbing to the patient, but it was very treatable. So I'll be talking to you about that a little bit later. So the types of things that I see as a sleep doctor is I see insomnia. And insomnia is obviously very rampant in the population generally, and it's been exacerbated tremendously now with all of our concerns and challenges. I also see sleep apnea, and we'll talk about sleep apnea and what sleep apnea is. I also see restless leg syndrome, where patients feel a fidgety feeling in their legs and an irresistible urge to move. I also see parasomnias. So parasomnia, P-A-R-A means around, and somnia means sleep. So this means something that happens in or around sleep that you don't really want to happen. So a perfect example is sleepwalking. Very common in children, less common in adults, but I'm also going to be talking to you about parasomnias where patients can do some very dangerous or violent things at night as well. So we not only see that, but we see patients with excessive daytime sleepiness. And hypersomnolence, hyper means excessive, too much. Somnolence means sleepy. And narcolepsy is a specific disease where patients have excessive daytime sleepiness. But interestingly, as a sleep doctor, I see patients who have to prove that they're not sleepy. So for instance, if you have your airline pilot, you don't want him to be sleepy during the daytime. If you have your bus driver, your metro rail driver, your cruise ship operator, you don't want them to be falling asleep on the job. So many of their employers require them to see a doctor like me to prove and document that they're not sleepy during the daytime. So let's talk about a couple of little things. So I've been researching some articles preparing for this talk today about how the coronavirus is affecting our sleep. And if you look at a survey that was done around the world, at least 22% of the people that were surveyed, that's a lot. That's just about a quarter of the people that were surveyed had problems with their sleep. That's a lot. It turned out to be more common in women. If you look at insomnia, insomnia tends to be more common in women. Less common in men, but then it becomes more common as you get older. Sleep apnea is more common in men. Insomnia is more common in women, but as you can see, things have gotten worse for both sexes now. Now, this was interesting to me. Generation Xers were more likely to have problems with their sleep, but this may make sense because as we get older, you know, I'm 68 and I'm still working, but if you think about it, a vast percentage of our population is younger. And so they've been profoundly affected by having to stay at home and the challenges with young children at home, with homeschooling, with all the different things that are going on. I've got that going on with my kids and my 10 grandchildren. I can tell you I hear about it on a daily basis, so I know that it's affecting them profoundly. So let's move forward a little bit And let's talk about things as well. So it turns out that there's an increased incidence of insomnia. We've talked about that, and it's trouble both getting to sleep and staying asleep. That kind of makes sense. And patients have been having very, very significant dreams and nightmares. I just had a patient the other day who's having significant nightmares related to this, a healthcare worker, and they're having nightmares about people being sick and people having terrible, terrible problems from the virus. So that makes sense. And then we're seeing this 24-hour news reports that really keep us in a state of anxiety. So believe it or not, sometimes I tell my patients, hey, listen, maybe it's best to turn off the TV for a little while. Don't listen to the news for a little while because it can be very anxiety provoking. And then there's disturbed circadian rhythm. So a circadian rhythm means the rhythm of our biological clock. So if you think about it, we all have a biological clock that tells us, for the most part, to stay awake during the daytime and go to sleep at night. And if you think about shift workers or people that sleep during the daytime and then have to go to work at night, that's a circadian rhythm irregularity. Jet lag is a circadian rhythm irregularity where people are going and flying to another country with a different time zone. But if you think about it, now that people, especially people that are working and providing our services, not only our healthcare services, but people that are driving the buses, people that are delivering your food, they're working kind of crazy hours that they didn't work before, and that can shift their rhythm. And when you shift the rhythm of your normal internal biological clock, it wreaks havoc on your sleep. Your sleep wants a regular routine. You do better with a regular routine. So that's one of the things that also can be affected. And then increased parasomnias. I just had one of my grandchildren is very, very concerned about things, and he just started sleepwalking and having problems. So this is a very, very interesting thing, that parasomnias, these abnormal activities at sleep, can be exacerbated by stress, can be exacerbated by changing your sleep patterns. So let's talk about sleep a little bit. So here's my virtual teacher there. That's not my teacher. That's not my wife, who also is a teacher and a vice principal, but that's not her. But let's talk about sleep a little bit, and let's talk about the basics of sleep. So if you talk to your family and you say, gee, what do you think happens when you go to sleep? And people would say, okay, well, you go to sleep and your brain goes to sleep and you get rested and then you wake up during the daytime. But that's not really what happens. What happens is your brain is very active during sleep. In fact, you use more oxygen in your brain when you're asleep. Your brain uses more sugar when you're asleep. So the brain is very, very active. And some people feel the brain is even more active in certain parts of sleep than it is even in the most active parts of wakefulness. So let's look at this a little bit. This is kind of what we do in a sleep study, and these are the different stages of sleep. So if you think about this, and you think about the different stages of sleep, if you look at the top of the slide, this is when you're awake, very active sleep, kind of lots of little jerks and rhythms there. That's when your brain is very, very active. And then as you can see, as you come down towards the bottom of the slide, your brain gets more sleepy. It gets slower. Those activities get slower and slower and slower. But look at this. At the bottom of the slide, if you look at the top of the slide here, that's when you're awake. Now go to the bottom of the slide. That's what we call REM sleep. That's rapid eye movement sleep, REM. And rapid eye movement of sleep is one of the deepest forms of sleep, is when you're dreaming, is when your brain is doing a whole bunch of things to process your dreams. It's processing what you learned during the day. It's kind of metabolizing different things, and it's using more oxygen. It's using more sugar. And interestingly, we now know in the last couple of years that in that REM sleep, that rapid eye movement sleep, it's getting rid of all the toxins in your brain. So all those abnormal things inside of your brain that you want to get rid of, just like your kidney is flushing out things from the rest of your body, your brain in REM sleep is flushing out all of those bad things. In fact, one of the theories now is that patients with Alzheimer's disease are not processing that REM sleep as well as they should in getting rid of the toxins that they need to get rid of. But look at the bottom of the slide where that circle is. You can see how similar that deep sleep, that rapid eye movement sleep, looks compared to wakefulness. So it looks almost like you're awake, and they call that paradoxical sleep. And the reason that they call it paradoxical sleep is it kind of looks like you're awake because the brain is so active. So I've always thought that was fascinating. So let's look at what we call a hypnogram. A hypnogram is what tells us what happens to you during sleep. So if you look at the left side of the slide, that's when you're just starting to go to sleep. And as you move towards the right side of the slide, you go into deeper and deeper sleep. So one of the things that we see is at the beginning of the sleep, you have more of what we call slow wave sleep and less REM. Rapid eye movement sleep are those little red squares up at the top there. And then as you move towards the latter part of the night, you have more rapid eye movement sleep. So you have slower sleep at the beginning of the night, and you have more rapid sleep. There's more active sleep towards the back part of the night. But let's talk about why is that important? Well, if you look at the first part of the night, you have what we talked about, more slow wave sleep. You have more slow wave sleep. So interestingly, you'll have more what we call slow wave parasomnias. So let's talk again. What is a parasomnia? It's doing something during the night that you really don't want to happen. It's an abnormal activity that's happening in or around sleep. And at the beginning of the sleep cycle, you have more what we call slow wave sleep parasomnias, and that's sleepwalking, confusional arousals. I just had a patient the other day who told me her mother told her that when she gets up in the middle of the night when she was a child, she would get up and start talking to the wall for no reason, as if it was somebody. And that's what we call a confusional arousals. One of my sons used to sleepwalk, and now one of my grandsons is sleepwalking. And that's what we call a slow wave parasomnia. It's more common in the first part of the night. And in children, it usually is very mild. It usually goes away after several months or a couple of years. It's usually not dangerous. But sometimes we see it in adults. And in adults, it can be very dangerous because they can do kind of dangerous things. But here's something that's even more interesting. In the first part of the night, you have more what we call parasympathetic nervous system tone. And the reason that that's important is your nervous system has different kinds of tone, different kinds of activity. If you think about it, there's activity when you're just kind of calm and relaxed, or when I'm talking to you now, but then there's activity when you're frightened. You can be very frightened and your activity is very heightened. Well, during the first part of the night, you have more relaxed activity, more parasympathetic tone. And what that means is that you're hemodynamically stable. And what that means is your blood pressure and your pulse and your heartbeat and your breathing is much more stable, much more calm. But look at this. As we go towards the second part of the night, the latter part of the night, remember I showed you on that first slide, there's more REM sleep, that rapid eye movement sleep. So if there's more rapid eye movement sleep, you're going to have more what we call REM parasomnias, those abnormal activities. And that can be a nightmare. It can be waking up in the middle of the night and feeling like you're paralyzed, like you can't move. And you can also have activity where you do these very dangerous things during the night. You can dream that somebody's attacking you, and God forbid you start punching. And instead of punching the person in the dream, you're punching your wife or punching the person next to you. And that can be very, very dangerous. Now, look at this. This is what we call sympathetic tone. Remember, in the first part of the night, we had parasympathetic tone. And now in the last part of the night, we have more active activity. And what that is, that's what we call the fight or flight. So think of that you're frightened. You want to run away from what's frightening you. Or think about something bad happening to you. Your nervous system gets all revved up. Well, what happens in that second part of the night is you become hemodynamically unstable. So that means your blood pressure goes up and your heart rate goes up and your breathing goes up. And that's why when you look at all the statistics, it's more likely to have a heart attack and a stroke and something really terrible happening to you in those last several hours of the night. And when you look at statistics, more people die of a heart attack of the early parts of the morning, right in the first couple of hours before they wake up. Okay, so now we know about sleep architecture. Let's talk about something that's interesting about sleep architecture. Well, if you look at mammals, if you look at dogs and cats, here's a dog and a cat, they have those classic cycles of sleep. They go through slow wave sleep, they go through deeper sleep, and they go through REM sleep. So we've all seen our dog kind of in their sleep, kind of sniffing and snorting and moving around and cycling and maybe even pawing, and it looks like they're having a dream. Well, it's because dogs and cats have REM sleep, rapid eye movement sleep. But look at this. This is interesting. So look at this. These are all mammals. But what do these mammals have in common? So these mammals, all of these, look at, there's a seal and there's a manatee and there's whales and there's porpoises or dolphins, and then there's birds. Birds are not mammals, but what do these all have in common? Well, this is very interesting. They have kind of diminished REM, rapid eye movement sleep, or no REM, which is interesting because we thought that was so important. So what does that mean? Well, we haven't figured that out. But even more importantly, all of these animals, the dolphins, the whales, the porpoises, and birds can sleep with one side of their brain and be awake with the other side of the brain. So there are reports of birds that can fly literally 10,000 miles at a time and without landing. And the reason that they do that is they can sleep with one part of their brain and be awake with the other part of the brain. So I always joke, gosh, if we could figure that out for people, imagine how productive we could be, but in a way that may be bad because your employer may expect you to work longer hours. But that's always been a fascinating thing to us as sleep physicians. Now, this is interesting. What are the things that I commonly see? Remember, we talked about this before. I see insomnia, I see sleep apnea. I'm going to talk about all these different things. I see these abnormal activities. I see people who are excessively sleepy. So let's talk about what kind of medical problems can be associated with a sleep disorder. Well, it turns out that if you name any sleep disorder whatsoever, anything that you can imagine, I can tell you a sleep problem that can be associated with that. So let's look at that list. Cardiovascular disease. I have heart disease. So I can tell you that there are certain things that are associated with heart disease. I can show you that with pulmonary disease, with gastrointestinal, you just think about if you have reflux, that can wake you up at night. Endocrine disease like diabetes, those are associated with a whole bunch of different sleep disorders. Infectious disease like the coronavirus, we'll talk about that. Arthritis can wake you up in the middle of the night. Neurologic disorders like Parkinson's disease can wake you up in the middle of the night. Obviously, chronic pain can wake you up in the middle of the night. And psychiatric illnesses. So we think about depression and anxiety. So let's look at coronavirus a little bit. So it turns out that if you have sleep apnea, and we're going to talk about sleep apnea. What is sleep apnea? It means that you're not breathing properly at night. And we'll talk about that a little bit further in a few minutes. But if you have sleep apnea, there's no reason to believe that you're at more risk for the coronavirus right now. There's no evidence whatsoever. I have sleep apnea, but there's no evidence whatsoever that people with sleep apnea are more at risk for the coronavirus. However, if you're over 65 years old, you're more likely to have a whole bunch of different illnesses, and you could be more at risk for the coronavirus. Indeed, if you look on the right-hand side of the slide there, all of these things have been associated with increased risk associated with the coronavirus. They have reported, even in young people in their 30s, 40s, and 50s, that have had strokes now related to the coronavirus. And for some reason, the coronavirus is causing people to form blood clots in their brain. You're more at risk if you have asthma, because one of the things that the coronavirus can affect is your breathing problems. You're more at risk if you have heart disease, if you have diabetes, if you have kidney disease. And obviously, if you have cancer and your immune system is suppressed, you can be more likely to get any infection at all, including the coronavirus. Now, you see there's psychiatric disease near the bottom of the slide there. So we're seeing, even in my practice, I'm seeing people, their anxiety is getting worse, their depression is getting worse, and post-traumatic stress disorder. If you think about it, when we had Hurricane Andrew here in Miami, or you think about 9/11, people could have these horrendous, challenging, horrific things happen in their life. And not only does it affect them at the time, but it can be a persistent stress even months or years later. And I think we're starting to see that even with the coronavirus. But the good news is there's things that we can do to treat every single one of these things. Every one of these things has a treatment that can be effective and relatively easy to address each one of these different things. So let's move along a little further. So how does your immune system work? You know, people talk about your immune system. What does that mean? Well, the immune system is what helps you fight off infection. So the things that are very important in the immune system are T cells, and T cells are white blood cells that help you fight off the infection. So think that you have a bacteria, or you have an infection, or you have a virus. The thing that's going to go attack that virus or that infection is a white blood cell that's going to go attack it and try to chew it up and get rid of it out of the body. Well, the thing that tells those T cells what to do are what we call cytokines. And cytokines are proteins inside of the body that communicate with the immune system, and they tell it what to do. Go attack that virus, go attack that bacteria, and get rid of it out of the body. So the immune system's very, very important to fight off these different things. So This makes sense. So why is this related to sleep? Well, if you think about it, what has a doctor been saying to you for years and years and years? Oh, I have a cold. What should you do? Well, the doctor says, get a good night's sleep. Go to bed, get a good night's sleep, have some orange juice, vitamin C, go to sleep, get a good night's sleep. But why is it important to get a good night's sleep? Well, we know that if you sleep more, your immune system is stronger for all those reasons that I told you. Remember, as you go into deeper and deeper sleep, especially in that rapid eye movement sleep, it's building up your immune system. It's getting rid of all the garbage that you don't want inside of your brain and helping to get rid of things inside of your body. And it's helping to boost up your immune system. Well, we know from different studies, if you get 7 or more hours of sleep, again, what do most people need? Most people need 7 to 8 hours of sleep to feel refreshed and to function normally during the day. Unfortunately, a lot of us, when we're working hard, we only get 6 or less hours. But if you get 7 to 8 hours, it's been shown that your immune system is stronger, you're less likely to get sick. When they did studies, if people got less than 6 hours of sleep, they were more likely, 4 times more likely to catch a cold or get sick. Okay, so here's kind of a funny slide. This is what I see all the time. I'll see a patient and his wife in the office, and I'll say, hey, do you snore? And we see snoring in men and women, more common in men. But I'll say, hey, do you snore? And the guy will say, well, I don't know, maybe once in a while, I guess once in a while. But the wife will say, what are you, nuts? You crazy? You're snoring all the time. You're driving me crazy. It's so loud I can hear you from the other side of the house. Well, let's talk about different things of what could cause snoring. It turns out that snoring can be due to what we call the upper airway. And if you see this air kind of coming in here through the top of the nose, that's what we call the upper airway. But then there's another part of snoring. Upper airway is just your nose or the deviated septum or inside your nose. That's not dangerous. It just makes a lot of noise. But then if you think about here in the back of the throat, if your throat is closing off like a kinked hose, that's what we call sleep apnea. So sleep apnea means as you go into deeper and deeper sleep, your throat becomes so relaxed that it closes off like a kinked hose. So not enough air can get in. So you literally stop breathing for seconds or minutes at a time. So if we do a sleep study, this is a sleep study, and these are different brainwave activities up at the top. These are different things with your eyes moving and your brainwave activity. But look at here. These different things here are your snoring. So you're snoring right here. And then look, you stop breathing. And then you start snoring again. And then you stop breathing again. And then you snore and you stop breathing again. That's what sleep apnea is. And it can be very, very dangerous. So why is it dangerous to have sleep apnea? Well, there's 2 reasons. One reason is if you're not getting enough air into your lungs, air has oxygen, so you're not getting enough oxygen. But the thing that we've learned over the last several years is when your brain senses that you're not breathing, your brain says, hey, come on, you gotta breathe, you gotta breathe. So your brain gives you a sympathetic nervous system battery jolt. And remember I told you that sympathetic nervous system is no different than being frightened because it wants to literally frighten you into start breathing again in your sleep. So what it does is it gives you that sympathetic nervous system jolt and you go, and you start breathing again. And so it's not just the low oxygen, but it's those arousals, those battery jolts that can make you more at risk for high blood pressure, for heart attack, for stroke, all kinds of different things. So what are the different things? What is sleep apnea? So sleep apnea is what I told you, you're closing off the throat. How do we want to treat it? We want to figure out a way to open up the throat. Well, one way is to lose weight. Sometimes it works, sometimes it doesn't. It turns out that 1/3 of the patients who have sleep apnea are actually skinny. So you can lose weight and still have sleep apnea. If you lay on your back, sleep apnea is worse because your gravity makes it more likely to close off the back of your throat. That's why you see these commercials that are kind of funny. I have a brother-in-law who says his wife bought one of those beds that is raising the bed every time he snores, and he goes nuts because all night long all he keeps hearing is zzz, 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 and the bed is going up and down. It turns out that he has sleep apnea, and it also turns out that even though your snoring can go away with your position, you can still have significant sleep apnea. So the other ways we can treat it is with an oral appliance that I'll talk to you about, and then surgery and education. So how does this work? Well, CPAP, which is called continuous positive airway pressure, it's just air. It's just gentle air that goes through your nose, keeps the back of your throat open. And by keeping the back of your throat open, air goes through, air has oxygen. So it tells your brain, hey, it's okay. Let them keep breathing. Don't wake them up in the middle of the night. So here's a classic case. When we do a sleep study, we can see how many times an hour people stop breathing. If you stop breathing more than 5 times in an hour, we consider that abnormal. If you stop breathing more than 30 times in an hour, we consider that serious. And if you think that there's 60 minutes in an hour, 30 times an hour would be every 2 minutes, because 30 times 2 is 60. So if you stop breathing 30 times an hour, that's every 2 minutes. That's a lot. If you stopped breathing 60 times an hour, that's every minute. That means you stop breathing every minute all night long for the entire night. Look at this. This is what I see all the time. Here's a classic patient that I saw, and he's a little bit overweight. His wife sees him snoring, and look what he has. This AHI means how many times an hour that he stops breathing. He stops breathing 105 times an hour. Remember, I told you 60 times an hour means you stop breathing every minute. So 105 times an hour is almost every 30 seconds. This guy stops breathing almost every 30 seconds all night long. You can imagine how detrimental that is to you. And his oxygen went down into the 80s. So then he gets CPAP, which is this gentle air that I showed you. This is kind of blowing air through the back of your nose. And look at it. He goes from 105 episodes an hour to 0. Literally 100 times better than he was without treatment. And his oxygen level goes back up into the 90s, is normal. I see this all the time with patients who stop breathing 80, 90, 100 times an hour. And they haven't done anything to treat them. And we treat them, and they're dramatically improved, and they feel dramatically better. So here, what are the different things that tell you, gee, maybe you could have sleep apnea? Well, obviously, if you're overweight, but remember I told you can be skinny too. It's more common in men than it is in women. But after menopause, interestingly, just like in heart disease, women start to become, to have sleep apnea more frequently. It's more common as you get older, more common after menopause. It's more common if you have a family history of it. Here's an interesting thing. In men, if they have a neck circumference, like here's my neck circumference here is 16.5. In men, if they have a neck circumference of 17 inches or more, that's considered a risk factor for sleep apnea. And in women, if they have a neck circumference of 16 inches, that's considered a risk factor. And the reason it's considered a risk factor, if you have more tissue around your neck, the theory is that then you have more tissue around your breathing tube inside, and it's more likely to collapse. So let's go forward a little bit. Here are some different manifestations that sleep apnea can do. You can have snoring, you can be excessively sleepy, you can be irritable, you can have a headache, you can have sexual dysfunction, you can have swelling. That's an interesting thing, swelling in your ankles. And obviously increased motor vehicle accidents. That's what the bottom is. That means car accidents. Because if you're sleepy, you're more likely to have a car accident. So here, what's the rationale for treating somebody with sleep apnea? Well, the rationale is, hey, listen, we want to improve your sleep, but we also want to make you feel more refreshed during the day. We want to have decreased, and we want you to have decreased risk factors for all these things on the left. Decreased risk factors for high blood pressure, heart disease, diabetes, stroke, psychiatric disease. But look at this. Also, it's considered now, sleep apnea is considered a risk factor for every form of cancer. And it's also considered a risk factor for sexual dysfunction. So impotence, sexual dysfunction, just had an article come out that said in young men, they can have infertility associated with it. So people used to think that, oh my gosh, sleep apnea, you have to wear this Darth Vader thing on your face, and it's, oh my God, it's like a scuba diving mask, and I'll never be able to do that. But over the years, we've gotten really teeny weeny things that can be much more comfortable. And here are some examples of different masks that we use. These are different machines that are relatively small. I had a patient bring me a machine from 20 years ago, and it literally looked like a big vacuum cleaner. It was so big, now they're tiny. These are little portable machines that they make now that are the size of your hand that you can take on a trip. This is a slide. So I see a lot of patients where actually the husband and the wife both have sleep apnea. And I always joke with them. I say, hey, listen, make love before you put on your CPAP machine. So this is Dr. Grant's recommendation for how to keep the romance alive in a marriage. Okay, so let's talk about sleep apnea and the coronavirus. We already said that sleep apnea does not make you more at risk for the coronavirus. Using CPAP does not make you more at risk for acquiring the virus. So if you have sleep apnea, not only should you keep using your CPAP, it's actually a good thing for you to keep using your CPAP, because it's going to improve your sleep time, and it's going to improve your immune system for ability to fight off any infection. Now, let's say if you have any symptomatology, or if you've tested positive for the coronavirus, obviously we want to tell you to keep using your CPAP. You should be doing isolation procedures, to sleep in a separate bedroom, to make sure you're cleaning your machine properly, washing your hands after you clean it. You should sleep in a separate bedroom, obviously, because there's more concern that you could be spreading the virus by using it, and general precautions of staying away from the unit and cleaning it on a regular basis. So obviously, if you have symptoms, you should seek medical attention. And what are some of the most serious warning signs of the coronavirus? Well, trouble breathing, persistent pain or pressure in your chest. And this is interesting. People think that, oh gosh, CPAP is the same as the treatment that you're using for the coronavirus. Well, it's a little bit different. If people really have profound difficulties in breathing, that's what we call a respiratory problem. It's a problem with your lungs. Remember, sleep apnea is a problem where you're just closing off your airway at the top, and all you have to do is mechanically open up the airway. But with people with respiratory disease or pulmonary disease from various illnesses, including chronic obstructive pulmonary disease like COPD, or emphysema, or now the coronavirus, that's a problem in the lungs, and they may need a ventilator. And what a ventilator is it's artificially breathing for you. It's not just passing air or there, but it's also breathing for you. And the other thing is, with a respirator, typically we're giving oxygen. Almost all of the time with CPAP, we're not giving oxygen because air already has oxygen in it. And if you open up the airway, air has oxygen in it, so it can help you just get back into that sleep and not keep being aroused. But if people have lung disease, they may actually need oxygen too. So here are some other therapies. Here's an oral appliance. Here's kind of a silly picture of somebody using an oral appliance. An oral appliance, typically you wear it in your mouth and it pulls your jaw forward. And by pulling your jaw forward, it can open up the back of your airway. But that has the risk that it can cause TMJ syndrome or spasm in your jaw in some people, and it can actually move your teeth around in some people. Now, here's another thing that's relatively new. This is what I partake in certain of my patients. I work with surgeons with this. This is called the sleep apnea pacemaker. It's called the hypoglossal nerve stimulator. And a hypoglossal nerve is a nerve that leads to your tongue. So what it does is it has a pacemaker inside of the heart there. It has a little wire that senses when you're breathing. And then it has a wire that leads to a nerve that leads to your tongue. And when you turn it on at night, every time, it sounds a little silly, but every time you take a breath, it sticks out your tongue a little bit. So it sounds kind of goofy, but in some patients who cannot tolerate the other kinds of treatment, this is a surgical procedure that may work for them. But it's actually a surgical procedure, just like putting in a heart pacemaker. So let's talk about insomnia. So what does insomnia mean? Insomnia means trouble getting to sleep, trouble staying asleep, getting up too early in the morning, not being able to get back to sleep, and feeling unrefreshed. And you can have any of those. So what if somebody has insomnia? What should we look for? First, look at medications, because a lot of medications can affect your sleep. A lot of heart medicines, a lot of arthritis medicines, a lot of sleep medicines, a lot of arthritis medicines can affect your sleep. So look at the medicine. Sometimes all I do is I tell a patient, listen, instead of taking that medicine at night, take it in the morning. And sometimes we want to talk to their doctor to see if we can find it. Look and see if there's another illness that you could treat. Look and see if there's another sleep disorder. So very common, sleep apnea is very commonly associated with insomnia. And very often, I can treat a patient with insomnia just by treating their sleep apnea. So that's very important. The other thing that's important too is we don't want to just throw a medicine at people for insomnia. It turns out that relaxation therapy is very important. I have a nurse practitioner and psychologist that I work with every day who are very, very well trained in helping people in relaxation therapy to help them in combination with or without medications. Okay, so let's talk about, this is one of the most important things that we can talk about now with the coronavirus. What are some good things that you can do to help your sleep right now? Well, you want to have a favorable sleep environment. So most people want it to be dark. They want it to be a little bit cool, comfortable, make your room cozy. You want to keep a regular routine. This has been a little bit hard. This took me years to figure this out, even for myself. I used to stay up too late because I get up too early. I get up at 5 to start exercising and going to the hospital and going to work. But it turned out that just by keeping a more regular routine, both on the weekends and during the week, of going to sleep even just a little bit earlier, can really be very, very helpful. You want to try to obtain at least 7.5 to 8 hours of sleep. You want to try to turn off the television before you go to sleep, because a lot of people, they don't realize it. They'll say, oh, doc, I need my television to go to sleep at night. But even that light flashing in the middle of the night can awaken your brain. The sound can awaken your brain. So it's better to have no TV, or at least have it on a timer to go off in 30 minutes. And it's better not to be looking at a blue screen like your telephone, like the computer, like anything with a screen, for at least an hour before you go to sleep. Here's another little thing: regular exercise. This turns out to be good for literally everyone. So if you're pregnant, non-pregnant, old, young, woman, man, mild to moderate exercise turns out to be very, very helpful. You just don't want to do it too soon before you go to sleep, because exercise can be stimulating. So you don't want to stimulate your body and then you can't go to sleep. But even mild exercise can be good. Just a little walk around the block, or just doing some minimal exercise in the house, can be very, very helpful. So avoid stimulants. So coffee, people don't realize it, but caffeine can have an effect on insomnia even 10 to 12 hours later. So I tell people, either get rid of your coffee or don't have it after lunchtime. So you don't want to have alcohol or tobacco. Alcohol is actually like poison to sleep. So it makes you sleepy, but then it never lets you go into the deep sleep. It fragments your sleep, and it can make sleep apnea worse because it's a muscle relaxant. It suppresses your breathing. And it's just not a good thing. Tobacco can do the same thing. In fact, all the movie stars drop dead because they mix sleeping pills and alcohol. So here, you want to avoid a heavy feel. You don't want to be literally eating Kentucky Fried Chicken right before you go to sleep, because it can make it hard to digest. It can give you reflux. You may want a little light snack before you go to bed. They usually recommend, if you're having terrible insomnia, to have no naps. But if you have a brief nap, that may be okay. You just don't want to have a nap that's so refreshing during the daytime that then you cannot fall asleep at night. So if you've got to have a nap, try to limit it to just no more than 30 minutes. So here are some other things. You want to practice some relaxing routines before you go to sleep. Either read a book, writing in a journal, watch something that's not stimulating. Obviously, the news is very upsetting now. You don't want to watch a crime episode where somebody's being shot and blown up right before you go to sleep. You want to do something relaxing. And this sounds interesting. If you can't go to sleep within about 30 minutes, you want to get out of your bed, go into another room, do something that's relaxing until you feel tired again, and then go back into the bedroom. You don't want your bedroom to feel like a torture chamber. And this is the other thing we wanted to talk about. White noise can be very helpful. There are a lot of smart apps on the telephone and computer that can help you on the telephone rather, that can help you sleep with noises and things like that. Usually no noise is better, but some people do well with either white noise or noise like it sounds like it's raining, or ocean waves and that sort of thing. So let's talk about parasomnias briefly. Again, what are they? They're abnormal activities that are occurring in and around sleep. The non-REM, the slow wave parasomnias, are sleepwalking. You wake up feeling confused. You have night terrors where you're frightened. These are very, very common in children. There's a new parasomnia in the last couple of years called sexsomnia. That sounds silly, but it's abnormal sexual activity that occurs during sleep, and this can actually happen. We see patients with this all the time. They can be a little embarrassed to mention it, but it's very treatable. So poor sleep and sleep deprivation can also diminish hormone production, including testosterone, cortisol, and growth hormone, which can affect sexual function and impotence. In addition, so let's talk about this, bedroom behavior and the coronavirus. In addition to insomnia and bad dreams, it turns out they did a survey, and it turns out that 1 in 10, that may not seem like a lot, but it's somebody's doing it. They said that they've been less intimate with their partner. They're just anxious and nervous. They're not having intimacy with their partner now, being affected by the coronavirus, by anxiety and stress. 5% began sleeping in separate bedrooms. People are not being so welcoming and letting their kids kind of come in and snuggle with them in the bedroom. So just a lot of behaviors that are changing. Again, we talked about slow wave parasomnias. We talked about REM parasomnias. So here's that patient that I talked to you about at the beginning. This was an actual patient that I had, and he comes to me and he says, hey doc, listen, I had sleep apnea. I was using my CPAP machine. My machine broke, and I'm coming back to you because I had this funny episode the other day. I woke up in the middle of the night and I was knocking on the door of my neighbor, and I was stark naked. And I have no idea how I got there. I have no idea what happened. And the neighbor opened the door and she said to me, well, "Hey, Jack, how you doing? What can I do for you?" And he said, obviously, he didn't know what was going on. And it turned out to be one of these abnormal activities at night. We just started him right up on his CPAP again, and he never had any more episodes. Then there's a parasomnia called Jekyll and Hyde. So it's the good person and the bad person. So the classic example of this is what I told you, is a person that wakes up in the middle of the night. They've had a dream and they're literally punching, grabbing, or pushing their wife or their bed partner. And they say, "Oh my gosh, I'm so sorry. I was dreaming there was a burglar in the house and I reached out to fight the burglar, and honey, what can I tell you? I woke up and I had my hands where they are. I'm sorry." And this was an actual case that I had. I see this kind of not infrequently at all. This is a wife who described her husband as snoring and kicking in his sleep. And then one night he woke up, literally, he's got his hands around her neck. She dials 911 while he's got his hands around her neck to relieve him. Well, it turns out that thank God he didn't hurt her. And he did well. We treated him. All of these things are very treatable, and most of the time we can treat them and they never ever happen again. So what have we learned from all of this stuff that we've talked about? We've talked about that sleep disorders are very common. They've gotten worse in times of stress. They've gotten worse with this coronavirus. But the good news is many of these things, if not most of these things, can be very effectively treated, where patients literally have very few symptoms. They feel much, much better. And this is kind of what I do all the time. I've been doing telemedicine now and even seeing new consults with patients through the telephone. And a lot of patients we can really help significantly. So here, you want to wake up like this because you had a crummy night's sleep, or you want to wake up like this where you feel great and you feel like a little Superman or Superwoman where you can really take on the day. Okay, so that's kind of my talk for today. I'm happy to answer any questions if there are any questions. I hope people were listening. Shantice, do you have any questions that anybody wanted answered?
Yes, thank you so much, Dr. Grant. I actually got quite a few questions. So thank you so much for sharing your expertise on sleep. That was very informative and entertaining, I have to say. So you mentioned nightmares. And so you were mentioning some cases where now nightmares may be heightened. Do nightmares occur more often in a specific part of the sleep cycle? I know at the beginning you were talking through a little bit regarding the sleep cycle.
Yeah, so nightmares are interesting. Nightmares are what we call a REM, rapid eye movement parasomnia. So remember we talked about the slow wave parasomnias that occur in the first part of the night. That's sleepwalking, confusional arousals where you're just kind of confused and dopey, or you can have a night terror. And each one of my kids has had one of those things where you wake up in the middle of the night, you're frightened and horrified. But the interesting thing about those is you don't remember them. So if you think about a person that was sleepwalking, they don't remember that they were sleepwalking. They have no recollection that that happened. But then you go further in the night and you talk about a REM, a rapid eye movement parasomnia. And those classic examples are you wake up in the middle of the night, you're convinced that you're awake, but you feel paralyzed, like you can't move, but you're fully aware that that's happening. Or you have a nightmare. And the classic example of a nightmare is you wake up and you say, "Oh my gosh, I had this terrible dream. I was having this dream that something terrible happened at work, or we were on a ship and something terrible happened. Whatever happened, it was terrible. And oh my gosh, I just woke up and thank God it was a dream." But you remember it. You have recollection. So remember, in a slow wave parasomnia at the beginning of the night, typically at the beginning of the night, you're sleepwalking, you have a night terror, you're confused. You don't remember those things. You can't remember that it even happened. Oh, here's an interesting example also of a slow wave parasomnia, is called not just the sexsomnia, but sleep eating. So if you've ever heard of that, people can get up in the middle of the night. There's different forms of sleep eating. So somebody can get up in the middle of the night and say, "Oh, hey, I remembered we had chocolate cake for dinner, and there's a piece of chocolate cake left in the fridge. I'm going to go get that and have some milk with that." You're fully aware that that's not really that kind of parasomnia. But then there's sleep eating, where people can get up in the middle of the night, go into the kitchen, they're pouring Coca-Cola into Cheerios, they're mixing all this garbage that doesn't make any sense. They go back to bed, they get up in the morning, and there's stuff all over the counter in the morning, and they have no memory that that happened. That's analogous to sleepwalking. That's a slow wave parasomnia. So let's get back to nightmares. Nightmares, you wake up and you remember that you had it. That's a REM parasomnia. Now, how do you treat nightmares? Most of the time, you don't have to do much about nightmares. It's just be reassuring, get back to sleep, and hopefully it's okay. Sometimes we have to treat them with medications, and there are all kinds of different medicines that we use, believe it or not, for nightmares. We use sedatives that are calming medicines. We use antidepressants. And this may sound silly, there's even a blood pressure medicine that's been effective in treating parasomnias, but it's a very special medication. So there's all different kinds of medicines that we use to treat these different things. And then sometimes what I also do is I have a psychologist that I deal with that deals with what we call rehearsal therapy. So think about somebody who keeps having horrific, terrible, terrible nightmares, somebody who was tortured when they were in the war, or somebody who had some terrible experience. They can do rehearsal therapy where they can actually learn how to enter their dream and manipulate the dream and get out of that bad nightmare. I just had a patient this week who was having terrible nightmares, and just by treating his sleep apnea, the nightmares have disappeared. He has no more nightmares. So it's an interesting thing. So in recapping, it's a REM parasomnia, rapid eye movement. It occurs typically at the latter part of the night. You have recollection that it happened, and there are a number of ways to treat it. Okay, next.
Thank you so much, Dr. Grant. Okay, wonderful. So next question is, what is the connection between the immune system and sleep?
Okay, so we talked about that. Remember I told you that the immune system, now sleep apnea is considered a risk factor for every form of cancer. And the presumed reason is because it's affecting the immune system. And now there are articles that poor sleep can affect arthritis, psoriasis, all kinds of different things that happen in sleep because of the immune system. So the reason that it's affecting the immune system is because if you're not getting enough sleep, you're not producing these hormones that we talked about, like cortisol, which helps you fight off infections. You're not getting the different kind of hormones that help you fight off infections. And what you're not doing is getting rid of the toxins in your sleep. So there's new studies out. If you think about it, we get blood through our body through veins and arteries. We get rid of things in our body through what's called the lymphatic system. The lymphatic system eventually gets rid of all the toxins and garbage that goes into the venous system and goes through the kidneys, and then you flush out. That's why people with kidney failure have to go on hemodialysis to help clean out all the toxins that were in the body and help the immune system. Well, it turns out the brain does not have a lymphatic system. There's no lymphatic system. The only way that it gets rid of all those toxins is in the different stages of sleep, typically REM sleep, rapid eye movement sleep. And then it passes it through what we call the blood-brain barrier, through cerebral spinal fluid, eventually back into the venous system, and then back eventually out through the kidneys. So sleep is very important to get rid of toxins, to give you the appropriate hormones to build up your immune system. Okay.
Thank you, Dr. Grant, and thank you for summarizing that again. And so related to that, what is your opinion related to sleeping aids like melatonin to give a restful and deeper sleep?
Okay, so there are all kinds of different forms of treating sleep apnea, of treating insomnia. So remember that first of all, make sure that it's not something else like sleep apnea. The next thing is something that's turned out to be very effective is what I told you about was cognitive behavioral therapy, is a very specialized form of relaxation therapy, typically done with somebody who's trained to do it. And then there are medicines. So there are over-the-counter medicines, and then there are prescription medicines. And prescription medicines are things like benzodiazepines, like relaxants, and then there are different kinds of sleep aids, but all of those different sleep aids have potential side effects. So we always prefer less medicine than more medicine. So let's go to the non-prescription medicines. One of the most popular non-prescription medicines is melatonin. So melatonin is a naturally created substance inside of your brain. So what makes us go to sleep at night? So as we go through the day, you get sleepier and sleepier during the day. The longer you're awake, the more sleepy you are. So that helps you go to sleep at night. And that's why taking like a 3-hour nap is not necessarily the best thing during the day, because it resets your cycle, and then it's harder for you to go to sleep at night because you haven't been awake as long as you would have been otherwise. So being awake through the whole day helps you go to sleep at night. The other thing that helps you go to sleep at night is what we call your circadian rhythm. And what happens when the sun goes down, it triggers your brain to create melatonin. And melatonin is made deep inside of your brain in a part called the pineal gland. And that melatonin is a natural substance that then marches over to the hypothalamus and shuts off wakefulness. It helps you to go to sleep. So melatonin is actually a natural substance that helps us go to sleep. And one of the things that decreases melatonin production is light. So even looking at your blue screen or your computer or your iPad or your cell phone an hour before you go to sleep decreases melatonin, makes it harder for you to go to sleep. Now, going to whether you should take melatonin over the counter, it generally is a safe thing to do. One of the problems with melatonin is it's not regulated by the FDA. So it's a non-prescription medicine. So I typically tell people to take a relatively recognized brand like CVS or Walgreens or some recognized brand, because to make sure that it doesn't have contaminants in it. The other thing is typically for insomnia, you need a relatively low dose, like 1 milligram, 3 milligrams, or maybe even 5 milligrams. For other things, we go to higher milligrams of melatonin, like 10 or 15 or 20, but just to help you get to sleep, typically you only need a relatively small dose of 1 milligram, 3 milligrams, or 5 milligrams. Now, the other thing that's important about melatonin works very differently than a sleep medicine. So if you were going to take a sleep medicine, like a prescription sleep medicine, you'd want to take it right before you go to sleep. But melatonin works based on your internal body clock. Remember, I told you it works on the circadian rhythm inside of your body and how all these different things are going on. So typically, if you're taking melatonin to help you go to sleep, you should take it several hours before you go to sleep. So say you go to sleep at 11 o'clock. I tell people take their melatonin at 9 o'clock and a couple of hours earlier. And that may sound silly, but it works much better if you take it earlier in the evening to help you go to sleep at night. Okay?
Wonderful, thank you. We have two more questions from our audience. So the next question was, can you describe the relationship between sleep disorders and neurological disease?
Sure. So as I said earlier, I'm actually a neurologist. So neurology is the study of the brain, the nervous system, the muscle system, how it interacts with the whole rest of the body. So remember I told you that sleep can be associated with any medical disorder, and specifically it can be associated with a number of neurologic disorders. So I'll give you a couple of examples. Talk about migraine. Migraine is definitely something that's associated with not getting enough sleep. There are migraines that happen because you don't get enough sleep. There are migraines that happen in the middle of the night because something's arousing you in the middle of the night. Headaches are a classic symptom as well of sleep apnea. And it's very common that we'll have patients with sleep apnea, and just by treating their sleep apnea, we help their headaches and help their migraine. Parkinson's disease, if you think about Parkinson's disease, which is slowness, a tremor, unsteadiness, as well as some other symptoms and abnormal movements in some patients, that can be associated with abnormal sleep, as well as a whole bunch of different sleep disorders. So Parkinson's disease can be associated with restless leg syndrome, with sleep apnea, with all kinds of different disorders of insomnia. And then even the medicines that we give for these different disorders can be associated with that. Alzheimer's disease. Remember I told you now, sleep apnea is now considered a risk factor for Alzheimer's disease as well, because you're not getting enough oxygen to your brain. So if you don't sleep well, it can affect those things. Also, it's the other way around. So you think about a patient with Alzheimer's disease, very often they start having irregular sleep patterns. So they'll start getting sleepy during the daytime, and then they'll be up all night long, where they have this kind of screwy sleep patterns where it's all reversed, it's all changed. And you know, grandma who unfortunately has dementia is now up and walking around the house at night and sleeping profoundly during the day. And that can be a challenge. So with all of these different neurologic disorders, including multiple sclerosis, headaches, migraine, Parkinson's disease, even seizures, they've shown now that if you have irregular sleep, including sleep apnea, it can even make you more likely to have seizures. So again, you can talk about literally almost any neurologic illness, and bad sleep can interrupt and make that neurologic illness worse. And also the other way around, those neurologic illnesses can impact your sleep, as well as medications given for those neurologic illnesses. Okay?
Thank you, Dr. Grant. I feel like you can talk about this all day.
Yeah.
We've got one more question from our audience. So why is it, a participant shared that when they sleep longer, they actually feel more tired when they wake up? Why is this?
When they sleepwalk, did you say?
When they sleep longer than their normal
Sleep
schedule.
longer.
Mm-hmm.
Oh, so that's interesting. So you'd think that, oh gosh, the longer I sleep, the more refreshed I would be. So it depends on what stage of sleep that you wake up from. It's interesting. They showed that when the way that we tell that people are refreshed, remember I told you that I see airline pilots and Metro rail drivers and bus drivers and those people, we have to prove that they're awake. The way that we prove that they're awake is we can do a test during the daytime while we're monitoring brainwave activity. So even though you think you're awake, we can tell if your brain is asleep. So that's how we tell that people have vigilance and they're awake. Well, it turns out that when they do those tests on most adults need between 7.5 to 8 hours to wake up feeling refreshed and to function refreshed during the daytime. They've done studies where, interestingly, people with less than 6 hours of sleep and more than 9 hours of sleep actually do worse. So you'd think that, oh gosh, it makes sense that you're with less sleep, you'd feel worse. There are very few people in the world that can get along with very little sleep. They're called short sleepers, but there are very few of them. That makes sense with less sleep, but why would you be more sleepy if you're sleeping longer? Well, there could be different reasons. So number one, you could be sleeping longer and not realize that your sleep is fragmented. That means that it's not really good sleep, it's fragmented sleep, and something else is interrupting the sleep. But the other thing is it could be, what happens is it depends on what stage of sleep that you're waking up from. So that's an interesting phenomenon that people, you'd think that sounds paradoxical. You'd think, oh gosh, if I slept for 12 hours, I feel even better. But for some people, they'll say just what that questioner said, that, oh my gosh, I feel more sleepy. But again, don't take that the other way around and think, oh my gosh, now I can get along with 6 hours of sleep. That's not the answer to that. The answer is to keep a reasonably regular routine, and the answer is try to do about 7.5 to 8 hours of sleep. One of our big problems as adults is we have what's called social jet lag. And that means that we have one routine during the week and a totally different routine during the weekend. So you go to sleep at 10 o'clock during the week and 1 in the morning on the weekends. And that kind of wreaks havoc on your system. So anyway, so it's better to have a routine, and again, about 7.5 to 8 hours if you can. Okay?
Wonderful. Thank you so much for your expertise and for sharing some of your time and insight on sleep during this COVID-19 era. With
So
that,
let me just say,
yes,
let me
go
just
ahead,
say
please.
something quick before. It just says to all the whoever's in the audience, if they're still there, listen. If you're having a problem with your sleep, talk to your primary care physician. They're very aware of these things nowadays. There are a lot of simple things that they can do for you, and if needed, they can send you to a sleep specialist. There are a whole bunch of sleep specialists that all of your PCPs know, so they can send you to somebody who can help you. So don't. One of the problems is they've done surveys before, and people are very reluctant to talk to their primary care physician about their sleep problems. So my advice to people is be open. Tell your primary care physician you're having a problem with this or that or whatever, because so many of these things are so effectively treated. So feel free and be open with your primary care physician about these things. Okay.
Wonderful. Thank you, Dr. Grant. And I just want to remind the audience, I did share information in the chat. We'd love for you to join us in some of our other sessions. Again, we do offer virtual sessions every single day, Monday through Saturday. Exercise, expert talks like the one Dr. Grant provided today, nutrition talks, meditation. So please join us. And with that, thank you so much again, Dr. Grant, for joining us. Any other closing remarks you'd like to give before we end the session?
No, thank you for inviting me. And I've been with Baptist Hospital. If you can believe this, I have been with Baptist Hospital for 40 years. That's hard to believe.
That's amazing.
So I can't even believe it. But anyway, so thank you for inviting me, and my best to the audience, and be safe. And my other advice is be safe. Listen to the doctors and the scientists about all of this stuff with the coronavirus. Take it seriously, and I wish everybody well, and be safe.
Thank you so much. Bye, everyone. Take care.
Bye-bye.